Study of the association between diabetes mellitus, anemia, and renal insufficiency for a group of individuals in the Shijak population. The aim of the study was to evaluate the association between diabetes mellitus, anemia, and renal insufficiency as the main diagnosis and as a concomitant disease in a population of 302 individuals for the year 2020 and 2021, where 82% of individuals are patients with diabetes mellitus. 50% are with anemia and 3% are patients with renal insufficiency. From the study was determined that in the 7-age group, individuals with diabetes mellitus have higher average value of azotemia and creatinemia, increasing the risk for renal insufficiency. In the 7-age group, individuals with anemia have higher average value of glycemic, increasing the risk for diabetes mellitus. In the 7-age group, individuals with renal insufficiency have lower average value of erythrocytes, increasing the risk of developing anemia. Diabetes is a group of metabolic disease characterized by hyperglycemia resulting from defects in insulin secretion, insulin action, or both. The chronic hyperglycemia of diabetes is associated with long-term damage, dysfunction, and failure of different organs, especially the eyes, kidneys, nerves, heart, and blood vessels. Diabetes is a highly disabling disease which can cause blindness, amputations, kidney disease, anemia, and cardiovascular and brain complication, among others, impairing the functional capacity and autonomy and individual quality of life. Anemia is a common nutritional deficiency disorder and global public health problem which affects both developing and developed countries, with major consequences for human health and their social and economic development. There are several types and classifications of anemia. The occurrence of anemia is due to various red cell defects, such as production defect, aplastic anemia, maturation defect, megaloblastic anemia, defects in hemoglobin synthesis, iron deficiency anemia, genetic defects of hemoglobin maturation thalassemia, or due to the synthesis of abnormal hemoglobin, hemoglobinopathies, sickle cell anemia and thalassemia, and physical loss of red cells, hemolytic anemias. The term renal failure denotes inability of the kidneys to perform excretory function, leading to retention of nitrogenous waste products from the blood. Chronic renal failure, or renal insufficiency, is defined as persistent impairment of kidney function. In other words, abnormally elevated serum creatinine for more than 3 months, or calculated glomerular filtration rate. Kidney disease can happen very slowly, without anyone noticing. Kidney disease usually affects both kidneys and can also cause damage to other parts of the body, especially the heart. For the study of diabetes mellitus, anemia, and renal insufficiency in the selected population are analyzed the value of glycemic, red blood cells or erythrocytes, hemoglobin, azotemia, and creatinemia. The first age group is 0 to 40 years old. The second age group, 15 to 24 years old. Third age group, 25 to 34 years old. Fourth age group, 35 to 44 years old. Age group 5 is 45 to 54 years old. Age group 6, 55 to 64 years old. Age group 7, over 65 years old. By means of calculations is found the average value of each analytical component. Table 1. Normal value of principal analytical components. For anemia is erythrocytes and hemoglobin. For diabetes mellitus is glycemia. And for renal insufficiency is azotemia and creatinemia. For diabetes mellitus, graphic 1. In the 5 age group are the highest glycemic value associated with decreased erythrocytes count and decrease in hemoglobin value. For anemia, graphic 2. For patients with anemia, the lowest average value of erythrocytes is in 4 age group, while the lower average value for hemoglobin is in 6 age group. For renal insufficiency, graphic 3. Patients with renal insufficiency in 7 age group, they also have low erythrocytes value, increasing the tendency of anemia to occur in this age group. Table 2. Correlation values of principal analytical components in patients with diabetes mellitus, anemia, and renal insufficiency. For patients with diabetes mellitus, the higher value of correlation is between glycemic and hemoglobin, 0.60. For patients with anemia, the higher value of correlation is between hemoglobin glycemic with negative value, 0.19. For patients with renal insufficiency, the higher correlation value is between azotemia and erythrocytes with negative value 0.8. Conclusion: patients with diabetes mellitus exhibit correlation for renal insufficiency with positive correlation value 0.11 between glycemia and azotemia. Individuals with anemia have correlation with diabetes mellitus and renal insufficiency. Individuals with renal insufficiency have more correlation for anemia compared to diabetes mellitus. Knowledge gained from this study are important for the prevention of concomitant disease, not allowing the deterioration of the health condition. Determination of the factors that causes diabetes mellitus, anemia, and renal insufficiency to diagnose the disease at an early stage for the most effective cure and to prevent the development of the disease toward its advanced stage.